any errors or additions or omissions. And Randy's all about that. I would like to actually add two things. On Monday, we had a seismic event. Oh, I'm going to admit Bruce while we're here. And we'll just also have Donna, as part of new business, give a quick update just on flu shots. So if anyone's questioned about that in the public, we can answer that. So we'll add that to new business as well. And we'll have a motion to adopt the September 16th, 2020 minutes.
Chief, just to interrupt, I think you also wanted to add Meet Your Street to old business as well.
Oh, excellent. Thank you very much. We could add that to old business. I appreciate that.
No
Thank
worries.
you. I have it down here. I didn't add it. So yes, thank you. So we'll add that to old business. And thank you, Donna. That's a lovely segue into old business. We'll start with a brief senior care facility update by Deputy Harmon. You're muted, Mike.
There we go. Sorry about that. Thanks, Chief. Yeah, still maintaining contact with the senior care facilities. They are doing well. Some of them have scaled back visitation, but as far as staffing and personal protective equipment, they're all doing fine. I continue to reach out and let them know if they do find a shortage in PPE, that I'm happy to reach out to our vendors and see what I can do to help them out. But all in all, they're doing well, and we're continuing to keep them off the list of outbreaks and continue to keep COVID-19 out of the facilities in the city.
Thank you. And we'll, Jesse has entered the waiting room. There we go. We'll also have Mike just tell us, and probably you could have Wayne interject a bit. Just we had a recent Rcmp fire drill. So how did that go?
Yeah, something that had been brought up to EPC for quite a while, and then COVID didn't allow us to do fire drills because we were busy in the EOC. But on October the 8th, we were able to facilitate a fire drill at the Rcmp station with some good takeaways. We actually had a prisoner in cells, so it gave the members on site an opportunity to figure out what the procedures were going to be there if we did have an alarm activation and we did have somebody in cells. We also talked about staff accountability. There's no kind of grab and go sheet for them to account for civilian staff or members that are on shift, so they're going to work on staff accountability. And then the last thing we were going to work on is a mustering station where all of the staff and employees are going to report to if we do have an activation.
It all went well on your end, from your perspective there, Wayne?
I was away. I didn't even know.
So it went perfectly.
Yeah, that's a little bit surprise for me. I was away that week, so that's a good update for me, Mike. And you were working with Colin and Laurel then on that exercise?
Yeah, I'm working with Laurel and with Deb as well.
Perfect. Okay. So were they going to report back to you on some of those recommendations that you made?
Yeah, once the drill was done, I did send a follow-up email to both of them just on the findings that I had. And I said, once you guys started to work on a plan, I'm happy to review that with the two of them and help move things forward.
All right, appreciate that, Mike. Thank you.
Marvelous. Now, Donna, if you could give us just a brief update on the Meet Your Street initiative.
Yeah, so since our last EPC meeting, we've actually had 2 neighborhoods host events, and it sounds like they went quite well. And we have 2 other neighborhoods just in the workings of creating events with them. I've also got a handful of interest from other neighborhoods, so just keeping that correspondence going. But so far, I feel like it's been well received and we've gained traction, so that's exciting. And Jesse and I are actually going to tee up this afternoon and just chat about mapping it for internal sake. But that would be my brief update.
I just made notes of that. I just made notes to that effect to see if you were going to do that, but yeah,
yeah. Now that we have some communities on the map that are active, we can start tracking that process. So it's going well.
Marvelous. That's good to hear. Any other old business anybody would like to bring up? We can transition to new business, and we'll speak about everybody's favorite topic, COVID-19. We did engage the public and look for some kind of a public questionnaire, basically just gauging on what the town did well, what we could improve on. I was just provided the results yesterday, so I have not had a chance to do a deep dive or analysis into any of the results. But what I did manage to kind of quickly glean is that, largely the results are positive. Sorry, they're largely positive. Some of the critiques, or the vast majority of critiques, were things that are out of our control. For example, mandating of mask wearing and detailing or locating where positive cases were on the peninsula. Both of those are things that are well above the pay grade or the abilities of a municipal government to do. So just after a real quick review or kind of synopsis of the results, maybe looking forward, or if we did this again, to more kind of clearly articulate what is in the town's control or sphere of control, and what are things that we can't control. So that's my very quick takeaway. I don't know, and I encourage others. I know Donna's provided a link to look through them. I'm sure we'll find some more things there, but that is kind of my real quick review. That's what I managed to kind of glean out of it. And I don't know if anyone else has had an opportunity to look at the results or have any comments. Randy?
Yeah, same as you, Brett. I just did a quick scan of it early this morning, and I would agree with your comments in terms of generally positive for sure. Just a question. What will we be doing with the results? Is this something that the committee would potentially recommend that it proceed to council for their information? Is it something that we want to publicize at some point via Town Talk or something? I don't know, but I just I'm not sure if anyone has a perspective on what to do with this and where it should ultimately go.
It's funny you ask. So Donna and I had that very discussion yesterday, and we had a kind of bounced it off of Krista, and basically it was felt that it was best that we would look to administration for some guidance there, because she had some concerns about potentially releasing it. I said that wasn't common practice, but it could be. So I was going to kind of have a better kind of deep dive into it, and then I would discuss it with you to decide what was the most kind of prudent way to move forward with it.
Okay. Yeah. No, that sounds good. Maybe I just, Councillor Duncan, from your perspective, do you think this is something that would be of value for council to see? I'm just wondering if you have any thoughts.
Well, I was definitely, jotting notes to kind of bring the takeaways forward as a councillor report. I'm certain that there will be councillors who want to be able to see it. But I guess I have some of probably the same reservations, especially as the chief says that most of the critique about what to have done differently was things that was outside of the town's control. And so at this point, I'd almost rather bring it forward as a council report first and see whether that generated discussion and what kind of discussion, because I am concerned about bringing forward something for discussion that ends up coming with recommendations for things that are not within our control, and getting off track that way. But yeah.
Yeah. Okay, that sounds good.
Well, in my initial thoughts were kind of in sync with Councillor Duncan's comments. Perhaps a brief report to council or a memo or something like that was kind of provided, a bit of a good kind of fulsome summary. Maybe that was something I was going to think of, and we can kick that around the next week or so. But that's kind of where I was leaning towards. So.
Yeah. Okay. Thank you.
All right. A little bit more on if no one else has anything in respect to the survey results. We'll talk a little bit about the second wave, public health on the island, as well as BC says, we're in the second wave. I quickly looked at the BC Cdc Dashboard this morning. I lived that for 3 straight months, and I was proud to say I haven't been looking at it very often lately, which is a good thing. Right now, there's 69 people in hospital in BC, and there's 0 in hospital in Island Health, which is excellent. There's 18 people in BC in ICU. There's none in Island Health. There's 1,688 active cases in the province right now, and there's only 11 in Island Health. So obviously Fraser Health in Metro Vancouver is kind of the epicenter, and probably 85% of the cases are there. That makes sense. So obviously the vast majority of our population is in BC, but the fact I think that we're on an island, and in particular here, we've been very diligent, bodes well. But nevertheless, we're quite concerned here, and that's why we have nursing home reports and weekly interaction with them, because those are the cohorts and the type of places where they do get, if it does get in there, those are the people that are already have comorbidities or immunocompromised, where this disease process or virus can really wreak havoc. So that's obviously our concern. So again, the numbers are good, but we need to remain vigilant. And I don't know if there's any other comments in respect to kind of how the business practices are going at Town Hall or Rcmp or what have you, but that's kind of our take here at the Fire Hall. Everything's good. Everything's awesome. Everyone's wearing a mask.
I got a couple things to say, Chief. I just was wondering if we should update and review our policy 6.9 for COVID-19 safety plan that Randy sent out. I believe the last amendment was in May. I know it still states that if people have signs and symptoms, they're to take 10 days off of work. And I know the wording's changed now because tests are available. It's really until symptoms are gone. So I'm wondering if we need to alter that, or if we're still telling people that if they have symptoms and they go for a test, they're off for 10 days because that's what the policy says. So that's just something to think about. And then the other one, just moving into the second wave with our staffing plan. When we were in phase 1, I know we looked at having some people working remotely. We looked at Public Works having part of the lunchrooms switching. So Parks went over and had lunch with some of the Public Works. We had staggered lunch times and break times. And I'm just wondering if that's something we look at with the daily increases approaching 200 a day now. And I know we only have 11 on the island or in Island Health. I'm just wondering if it's something we think about moving into the colder season and when we could see spread grow again.
Yeah, those are all good questions for sure. The big concern is that it's the two drivers of this are duration of exposure with others, and then against the concentration. So everything kind of relies on kind of minimizing those. So in the summer, where people can kind of be out and about and practice physical distancing, that's one thing. The big concern is as we get into the colder months, obviously people just more naturally, congregate inside spaces, which the virus thinks is a great thing. So that's part and parcel of why we're seeing this increase in numbers. And as it gets colder, it's only going to get worse. So I think that's something we need to look at. And I've also flagged something that I'll be working on probably in concert with Randy and Mike, is just a quick refresh of our internal business continuity plan, what that looks like, and just to make sure that we have, from a staffing perspective, I think we've done a lot of great work when we had the EOC up and had a lot of plans in place, but just make sure that our staffing and everything that we put in place is still in place, that if we did have to kind of go backwards and implement different staffing models as a result of an increase in cases that, you know, we kind of had a shovel-ready plan we could simply implement that was very current and not 3 or 4 months old. So that's something that we'll be looking at in all of our spare time here in the next couple of weeks.
With respect to the safety plan, and taking a look at that, I would agree with Mike that yeah, it's not a bad thing for us to review that again and see if there are. I mean, I can quite frankly think of at least a couple of changes or modifications that need to happen with respect to the safety plan, in particular around room capacity as we move forward with plexiglass barriers within the council chambers and potentially seeing more councillors returning to the chambers for meetings, etc. That's going to have an impact on the overall capacity of the room, and so we might want to revisit the capacity numbers. I know in the Arbutus room that I think there's a limit of, is it 7, I believe, but I think that we can probably get at least 1 or 2 more in there again and retain and ensure physical distancing, that sort of thing. So our sort of aspects of the town hall in terms of how we've been able to be successful, I think, in following the overall safety plan, I think has been pretty good. I think staff have done a good job in terms of implementing the protocol that's contained within the plan, whether it's ensuring, you know, the physical distancing within the general office areas, and you know, wiping down surfaces in meeting rooms and those kinds of things before and after. I see that happening now, and it's becoming almost routine, which is good. So, but it doesn't hurt to again look at that plan again and make sure that that it's up to date and current, and that the appropriate practices are being followed.
Yeah, and I would thank Mike for bringing that up. I know that, you know, I've had a COVID test. It's definitely not fun, but once you get that negative, you know, I don't think you need to continue to take your 10 days off work. You come back to work. You know, that should probably be articulated in the plan. Andrew?
Yeah, similar to what Randy was talking about in terms of room limits. When we brought the idea to council about reopening for meetings, a concern was raised about the ventilation systems. Where do we get definitive information about that kind of thing?
You know, that's a great point. Well, obviously we'll talk to Rob Cook, because I know that WorkSafe has a calculation based on the number of entrances, exits, as well as kind of the square footage of the room. I don't know how they put that in respect to, you know, the air exchange, or if they have a formula for how the air movement is tracked in a room. I don't believe it's that sophisticated, but I would probably defer to, or perhaps ask Brian, but I believe there's likely a WorkSafe guidance on how to calculate the number of persons allowed in any room. And I know various openings, windows, and a number of things kind of play into that. So I would ask Rob.
Okay, I was on a webinar last week where that was briefly discussed, and a health officer indicated that most HVAC systems were sufficient and nothing special was required, but I would like to confirm that somehow. So yeah, we'll check with WorkSafe.
Okay.
Yeah, just to comment on that, I'm sure that goes basically on building codes, on air exchanges in a building based on occupancy levels and things like that. Certainly here at operationally, you know, we've got so many doors and windows open at different times. I think we're okay on our side as far as that goes. And again, I think based on the stuff that we did very early on, those processes and protocols, if we did need to split shifts, separate 2 working units in operations, we could go into that. I just wonder what the threshold is, knowing that we've had 13 positive cases on the Saanich Peninsula since January the 1st. So is that number going to be if we hit, 100 positive cases on the peninsula or 200 positive cases? When do we want to re-implement to get back for there? Because I think we're pretty safe looking at things on the island, especially on the peninsula as well.
Yeah, and I don't participate, Mike and Donna participate in the almost daily calls with Island Health and the province. So I think we'll let, as that ramps up or as that guidance comes from the public health officers, we'll probably, look at that. I don't know if there'll be a specific threshold or number that we'll target, but we'll get a good sense of their comfort level. And then also look at it through the lens that, we're not Langford or View Royal. We're the 3rd oldest, municipality or kind of cohort of residents in the province. And it's not about us getting sick. It's about us potentially getting sick and then spreading it or having an interaction with, the vast majority of our residents that are over 65 and immunocompromised. And those are the ones that are going to really suffer. It's not, in reality, our staff will probably come through it largely unaffected. It's protecting those at risk, which we have a disproportionately high number of people in our community, is kind of the lens we need to look at it from, at least in my perspective. So if there's nothing else on that, we'll just kind of move on. I've added a few things here. Is our mass emergency notification service provider. Donna and Mike have been working on this, and by a little bit of background, our provider is Rcmp, which was a provider of emergency mass notifications. You get the mass notifications if there's a tsunami event or something like that. There seems to be a large consolidation of that business in North America, and they've been purchased by Rave Mobile in entirety, which is a US-based company. They've advised us that they're purchasing them and their server sites. So their server sites in Kelowna and as well as outside Toronto. So all the Canadian data is still stored in Canada. It's compliant with the Patriot Act. So there's no issues about privacy. But they basically just said that we would like to sign you up, but this is a new platform. You're going to have to make all of these changes, and a lot of the legwork and work to transfer people over and the like you're going to have to do it. We're not going to do it for you. Also, the usability from our perspective is not really there. So we're looking at alternatives. Looking at some other options that will probably result, I don't believe it'll result in an increase of cost. We've reached out to one of our municipal solicitors just to confirm that the transfer of data and the storage of people's personal information they provided would be maintained, and we wouldn't be putting their data or the town at any kind of legal risk. And it's fortunate that this person at Young and Anderson served as the BC Privacy Commissioner for about 5 or 6 years. So he's very well versed in that particular field, and provided us with some excellent information and some contractual language that we would put into whatever service provider we chose. So we're working on trying to, obviously it's to everybody's interest that we choose a provider that's consistent with our mutual aid partners and others. But if worse comes to worse, we may choose to go it alone and go with a provider that works best for the town of Sydney. And the reason that we would consider that is that we, in comparison with North Saanich and Central Saanich, we have upwards of 4,400, almost 4,500 users, and invested a tremendous amount of staff time to get 35-37% of our population signed up. Where they're in the 8-10% range, they're in 1,100, 1,700 people. So this is a huge investment that we want to maintain, and we don't want to go to 4,400 people and basically say, we need you to sign up again and go through this process again, because we really think that that will result in a loss of subscribers, which is obviously complete opposite of what we want to accomplish. So we're working through all of that. I just wanted to keep this group apprised that that's a process we're going through, and hopefully it's seamless, but that's what's going on in the background, and we'll keep you up to date. So I don't know if anyone has any comments on that, or Mike, you've been kind of front and center on that. So
no, I think right now we'll just wait and see what our the two other municipalities are thinking. We've reached out to one other vendor to see what the program is like. I think they're willing to help us on the back end, get things up and running, and do a lot of the light work to make it happen. So just keep working with Donna and the chief on this, and we'll report back when we have more information.
And just to follow up, the CRD is also looking at options, and we'll obviously, if there's a good CRD option that we can leverage and get and work with, that retains kind of the autonomy that we want to be able to provide our residents, we'll happily join in on that as well, because they have all of their electoral districts are, and many of them on the West Coast, you know, the tsunami threat is real. So they're really, it's a much more of a requirement for them for that perspective. So we're keeping apprised of what the CRD is doing as well. And if there's a good option that we can join with, we'll definitely entertain that. So that's where we're at. We'll jump into now a couple of things I've added is just the, on Monday, we had a seismic event. I don't know how many people were aware of that. Up in the Alaska Panhandle area, it was a 7.4. It was upgraded to a 7.5. The province, we need to kind of follow up with the province. They were really slow on pushing the information out. I subscribe to, and as emergency manager, as Mike does, the Northwest Tsunami Warning Center, which is in Palmer, Alaska. And they're the US are really the ones that have invested in all the buoys and data points up and down the coast that provide that information. So I had an email and basically pushed out our notification based on that data long before the province did. And then they showed that there was no issues or potential tsunami threats to coastal BC. And we pushed that information out to our residents while the province of BC was still assessing it. People are saying, well, why did you push this out? And basically we were just using the data from the Northwest Tsunami Warning Center. So we were probably about 20 or 30 minutes ahead of the province on that. So I'm sure lots of people in jurisdictions will be following up with the province of why we're kind of slow on this one. I know a lot of people have been very critical of the province. I think a lot of everybody in the province right now is still working in their basement. So I don't know if that affected their ability to kind of get a quick notification out. But nevertheless, that was something we managed to get out pretty quick and ahead of the game. So we were happy with that. And I didn't know if anyone had any questions or what alerts they had or any feedback in respect to that event. So nobody knew, nobody's worried about water. That's a good thing. I know Andrew called me and was worried about running to higher ground, but I told him he didn't have to. So
I was going to ask if that had gone out on our emergency notification, because I was just like, I saw it it came up like in my news feed eventually that it had gone out, and I'd never got a notification. And normally if I get them, they go to my home phone and never to my cell phone anymore. So I clearly need to fix that. But so did you just send it out, like the notification to people elsewhere in the town, like the Facebook and Twitter, or did it?
Just put it out on Twitter. So the threshold that we have for actually using our mass notification system, you know, that's not something we're going to use unless it's actually the province or the Northwest Tsunami Warning Center is basically saying there is a confirmed warning for X. Now, and again, we look at that through a whole bunch of a different lens. So I know that a tsunami event that far away is probably we're in the 90-minute threshold. So I have 5 or 10 minutes to vet that, and I'm not going to, you know, incite a bunch of panic until we get hard data saying, yes, there's an absolute validated tsunami warning for area E, which we are, in our area. So that's what we'll wait. But as soon as something of that magnitude happens, we want to get ahead, at least on the social media aspect, and just say, this is what's happened. It's under advisement or it's being assessed, because it takes time for the waves to go through the various buoys they have out there and that data to get fed back to the scientists to say that's not an issue or it is an issue. So there's always a 15-minute waiting game. The only time where we would push the panic button without that is if there was an event in the Strait of Georgia where there would essentially be no time for us to do that, and we would just default to being precautionary and then, you know, kind of wear the public ire if it didn't happen, because we just wouldn't have time. That would be the only circumstance in our plan. So good. And I guess this, the last thing is that I know flu shots have been a bit of a topical issue around, and Donna can probably just speak to that and where we are in kind of flu shots for the public.
Yeah, so we've talked about it quite a bit in this committee and just amongst town staff, but if you aren't aware, Island Health does have a public clinic going at Mary Winspear, and you can book online through Island Health. So it's November 17th, 24th, December 1st, and 2nd. And also on Island Health, you can see which pharmacies are offering flu shots. So in Sydney specifically, when I checked this morning, there was 4 pharmacies offering them, and they provide information on how to book those as well. So Island Health has made progress on making it more accessible for booking flu shots, but just so an FYI, we're all aware.
Donna, do we have any linkage to that on our website or social media sites? So if people are looking for us for information, we can push them to that Island Health website, or those, is that something we can look at?
We can look at that. I know it's been shared on social media. I'm not sure if it's on the website, but I'm sure Krista and I can easily implement it if that's an action we want to take.
I don't know, Randy, what do you think? I don't think that's a bad
That was
thing.
going to be, you took the question out of my mouth, Brett. That was my thought as well, is that I think there's a significant amount of interest in our community about flu shots, and it was a topic of our last virtual town hall. Shoreline Medical, there was a presenter from Shoreline Medical that talked about it, the potential of the Winspear Center for immunizations and for flu shots, and but didn't have the dates established. So at the time, so I think there is, like I said, a significant amount of interest. I think I don't know, they've had just an incredible number of calls and inquiries about flu shots. So it's a hot topic in our community, and anything I think we can do as a municipality to put the word out where folks can book to get a flu shot, I think it would be great if we can do that. So again, either through social media or website, whatever resources we have to put that out there, I think would be helpful.
Definitely, yeah. Krista and I can work on that then. Shouldn't be hard at all.
Excellent. Yeah, and I would just hope that, you know, speaking with some other emergency managers and even, you know, my colleagues in the ambulance service, that, you know, the hope is that flu season will be somewhat mitigated by the fact that, you know, COVID has pushed everybody into, you know, and rightfully so, some degree of physical distancing. But if there was ever a time that our populace was diligent washing their hands and using hand sanitizer, and, you know, after worrying about touching things and disinfecting hard surfaces where these viruses can live, you know, now would be the time. So hopefully a lot of the good work that people are doing to not contract COVID will also carry over and reduce the severity of the flu season. Time will tell, but hopefully that will play out and be one of the few benefits of this, what we're going through right now. So that's all I have. I'd open it up to a roundtable if there's any questions or any items anyone would like to bring forward. Now would be the time. Mr. Newcomb.
Just a quick update on the official community plan review project. We're just finishing phase 1 of that, which was kind of a background review and research stage. So a lot of internal work by planning staff and the consultant. We're just moving into phase 2, which is called Explore Options. So we'll be reaching out to the community on numerous occasions, and we'll also be starting to look at some land use options. One of the events, probably in early December, will be a design charrette, looking at specific land use options, looking at things like building design and so on and so forth. So it would be great to have some representation from Sydney Fire there if possible, to look at safety and emergency response side of things. And of course, we'll have other staff and council there as well. So yeah, if anyone has questions on the OCP stuff, just let me know.
I'm happy to attend, and I understand there's even a decent chance it might even be held in this building. So that's, I wouldn't have to travel far, so I'm good with that. So we'll definitely make that work. So not an issue.
Yeah, we're just looking at how much space we'll need. Where it's looking a little bit on the cusp of can we do it in that space or not? So yeah, but we can talk about it.
Sure. Yeah. When we open up our 2 rooms, the max is 18 in that particular in that space when we open it up. So that's kind of what we're working with. I guess the other option that we didn't discuss, Corey, while we just have it here, is we could do it in the apparatus bays, which would obviously, it's a little bit more industrial, and pull the trucks out, but that would provide a larger space as well, and we can have big doors open there. Obviously, it'd be a little bit of noise, but that's an option as well.
Sounds kind of cold.
Oh, no, it's a new building. We'll provide some heat, but again, you're not going to get rained on. There you go, and the cost is right, the fee's right, so you're doing all right there. So
yeah, I'll talk to the consultant, see what their needs are too. Thanks.
Yeah, like 17 million.
I'm surprised no one asked what the heck is a charrette.
Oh yeah.
Quick overview on charrettes. It's like a kind of a design session where you have urban design and planning professionals, sketching up ideas on the fly, sort of bringing people's conversation into reality and what it might look like on the ground. So yeah, thanks, Randy. Too much planning jargon in my brain these days.
Oh, no, it's charades.
Yeah.
It's very similar.
Planners that need fluffy coats because they get cold, I think that's the problem.
That's right, yeah.
Yeah. Is there
thanks.
anything else? Brian, you're good?
Yeah.
Good. Well, that's great. If nothing else, our next meeting is November 18th, and I thank everyone for their time, and I'll have a motion to adjourn. And Mr. Newcomb, excellent. You got all that done. And Mr. Hissick, well, thank you all for your attendance, and we'll see you on the 18th or before. Thanks again.
Thanks, Brett.